You see that okay? So yeah, yeah. Okay. Hi everyone. My name's Fran Ives, and I'll be doing the first session today. So I'm really pleased to be able to kick things off. So I'm a innovation project manager at the West Midlands Academic Health Science Network, but I'm also a chartered human factors specialist, and I've been working in human factors for most of my career in automotive, in nuclear, and then latterly, and for the majority of my career in healthcare. So what I want to do today is to really just give you an introduction to human factors. So don't worry if you're completely new to human factors. My aim is to really just give you a taster of the science with some practical examples, real life examples, so that you can really start to appreciate the impact of considering human factors in the development of any innovations, whether they're your own or perhaps supporting colleagues with theirs. So forgive me if you already know quite a lot about human factors. I am going to start from the beginning and build up and just give you a bit of a taster. Some of you may be familiar with the term human factors, but not with the term ergonomics or vice versa. The Chartered Institute of Ergonomics and Human Factors in the UK use the two terms interchangeably. So that's what I will do in the session today. So if I switch between one or the other, yeah, I'm using them interchangeably. So human factors and ergonomics is all around us. So anytime you engineered a product, you've changed a process or a system to work more efficiently, you've practiced human factors. So the goal of human factors is really to reduce human error, to increase productivity, enhance safety, and enhance comfort, with a specific focus on the interaction between people and a thing of interest, a piece of equipment, a task, an environment, etc. So human factors is really a bridging discipline that brings together what we know about anatomy and physiology, psychology, engineering, design, to make sure that whatever we create for humans to use really complements the strengths and abilities of people, and it minimizes the effects of their limitations. So I have to say to people that good human factors really helps people succeed, and poor human factors causes people to make mistakes and get tripped up. I've taken this diagram on the screen from a model that we use in human factors in healthcare. Don't worry, I'm not going to go into any complex models today. This is the SEEPS model, which is Systems Engineering Initiative for Patient Safety. Don't worry about that. The reason I've used this diagram is because it nicely illustrates some of the main areas of ergonomics and human factors. And really one of the main things to think about when you're considering human factors and ergonomics is that people are at the centre of the work that we do. And it's important that we understand people, we understand their anatomy, their physiology, their anthropometry, which is body sizes, their biomechanics and their psychology, in order to consider and understand how they might interact with other elements of the system. So the system being what we've got on the screen there, how they interact with other people, how they interact with tools and technology, with the organisation, with the environment, and with the tasks that they're going to be doing. So when you're looking at designing or creating anything that's used by people, it's really important to think about who's going to be involved in the situation you're considering. So who are those people right at that centre of the circle that you're thinking about? People who are going to be interacting with the task or the equipment that you're considering changing, designing or improving. So in a healthcare setting, that could be patients, it could be their carers, their relatives, but also the clinical people who they'll interact with. So the doctors, the nurses, the AHPs, the domestics even. Moving out to the other elements of the system, thinking about tasks, the tasks that we're going to be requiring people to do. A task is whatever we're asking people to do, and it could be a task that's very repetitive, It could be a task that needs to be done in a set order of steps, or it could be a task that the end point is the most important bit, and we don't really mind how people get to that position. So in any task that people undertake, they'll probably interact with some kind of tools or technology. Really, what we mean there is equipment. So it could be something really basic, such as a pen, or it could be a complex piece of technology, such as an anaesthetic machine. So people will be doing tasks, they will be interacting with tools and technology, and there will be an environment in which they're working. The environmental element can be split into two things. So we can be thinking about in the internal environment. So what's the temperature like? What's the lighting like? What's the layout? And the external environment is usually things outside of the organisation's control, such as regulations, laws, procedures, etc. Environment is really important because even if you have an innovation, for example, that's a piece of equipment, the person who's operating that piece of equipment will still be doing so in some kind of environment, whether that be in an office, in a clinical area, or even in the middle of the countryside. And then finally, considering organisation. So that could be the structure of the organisation you're working in. It could be about looking at how rotas have been developed and designed. It could be looking at training levels, staffing levels, etc. I'm going to go into each of these elements in a little bit more detail with some examples to help illustrate them further. But really, it's important that when you're thinking about human factors, you consider all of the elements I've mentioned here, because the human will interact with each of those elements. But equally, there will be interaction between tools and technology with the environment, for example. So if you're designing a piece of equipment, it's important to think about, for example, the temperature of the environment at which it's going to be used at. The altitude, even if it's a piece of equipment that's going to be used outside at a high altitude setting. So recognizing that you can't just focus on one particular element of this diagram without there being ripple effects in other areas of the system. So I'm going to go through each of the different elements to try and help illustrate them further. And what I want to do here is to have a little bit of interaction, and anyone can do this, the speakers included, if you want to get involved. What I want you to do is, or what I'm trying to do, is to get you thinking about human factors and ergonomics already. And I'm going to ask you to do this by considering a piece of equipment that I'm sure you all own and that you interact with numerous times a day. And that is your mobile phone. So what I want you to do is to consider what the best thing about your mobile phone is. And it can be absolutely anything, but I want you to think and to tell me what the thing is about your mobile phone that you really, really like and enjoy. Now, in order to answer this, you can ideally take yourself off mute and sort of shout ideas out. If you'd rather put the answer in the chat, then that's okay as well. I don't want you to think too much about this. I want you to just sort of go with your gut feel of what it is. You know, what's that thing that pops into your brain straight away? What is it that you like about your mobile phone? So any thoughts from anybody on the call? Give me a shout. Look, so Chris likes the fact that he can look stuff up. It's easy to use. Tammy likes the apps. Any others? So someone's saying that they like the color. It links with other apps. Okay. You can take pictures. You can do work on the go. You can get your emails. Okay. So some really good ideas there. And you can categorize these ideas really in terms of aesthetics. So somebody said that they liked the color of their phone. So that's the aesthetic element of that piece of equipment. People who like how it's used, how easy it is to use, are thinking about the usability of it. We've all interacted with pieces of equipment that are really easy to use, and those are the pieces of equipment we don't really think too much about. The pieces of equipment that we often remember are the ones that are really frustrating to use, the ones that we have to get the instructions out, or we feel like we're constantly making errors and mistakes. They're usually the pieces of equipment where ergonomics and human factors hasn't been considered particularly well. And a lot of the answers that were coming through related to the functionality of the piece of equipment. So lots of people were saying that they liked the apps, they liked being able to look things up, they liked being able to store phone numbers because they can't remember them. And that's really about the functionality. So a phone has become a lot more than a device where you speak to people directly. It's become a mini computer, and people often really like the fact that they can do all sorts of stuff on it. Very rarely when I ask this question to people do they say that they like to be able to make phone calls, which was the original purpose of the mobile phone, but it's developed so much further. So you've given me some examples of the things that you like about your phones. Is there anything that you would change? So if you had a magic wand and could change anything about your phone, what would it be and why would you do that? So again, either take yourself off mute or pop it in the chat. There's usually some ones that come up time and time again, so I'll wait to see whether those make it lighter so it's easy to fit in a bag. Storage capacity, yeah, that'll be mine as well. Chris wants to stop people calling in. Change your number, Chris. Location of the buttons. Okay, that's an interesting one. Usually, I'll just switch, Sarah. That's a really great one. The size of the screen. Zena said battery life. I was just going to say that normally the two things that come up are battery life, and also you can tell the people who've got iPhones, because they're usually the ones that say they want a more durable phone because they've got a cracked screen. So often the things that come up can be quite generic things that would perhaps also irritate a lot of other people. So I know someone mentioned storage capacity. That's something that isn't necessarily going to irritate everybody, but could probably be quite a common gripe. Battery life. Although I think someone's just mentioned a particular brand that's got a really good battery life. Other people mentioned things like buttons, size of screens, and the size of the device itself. Now, if you were to change those things, it's really important to think, if you were developing a product, about whether changes that you make would suit everybody or whether they were quite personal to you. And I think this is really good to illustrate the example of a mobile phone, because it's a piece of equipment that's used by so many different people. And the age range of people that use mobile phones is absolutely vast. So you get children using mobile phones, but equally you get people sort of 90s and plus using mobile phones, perhaps with all very different wants and needs, but also with different sizes of hands, different dexterity. So thinking about the changes that you would make is interesting, and taking that further, have a think yourself about whether the changes that you would want to make would suit all of the potential users of that piece of equipment. I want to give you another example here. Now, we are still talking about tools and technologies, but this is one that perhaps spans tools and technologies, but also the environment as well. Now, this is a road junction that I encountered a number of years ago in Italy. And fortunately, I was only navigating this road on foot rather than by car. In terms of tools and technology, what do you think? So we're thinking really about equipment, and equipment can be anything that's helping you to do the task that you're intending to do. Can anybody think what might be challenging here to a driver who was unfamiliar with the road and perhaps driving without a sat nav? Any thoughts as to what might be tricky here? How can you find
driving into oncoming traffic?
Potentially, yes. Yeah. And why might that happen, Chris?
Well, especially for us Brit drivers, because we drive on the right side of the road, or the wrong side of the road in this case.
Yeah.
But obviously there's no clear demarcation across the junction.
Yeah. So the junction itself is quite complex to figure out, particularly if you're unfamiliar with it and you're coming to this junction for the first time. The other thing as well, which people have commented on, are the road signs. So where are the road signs and what do they say? So there are some road signs, and if I flick on the next screen, you'll see what those road signs actually look like. So not only are there 11 separate road signs here, but there are different font sizes, different fonts, different colours. Some signs are obscured by others. So relying on navigation here by signage alone could prove to be quite challenging. In theory, there are lots of signs on the road, very detailed signs. So you could say, well, why did somebody go wrong at that junction? Because very clearly there was a sign there pointing to the direction which they wanted to go. But actually, when you look at the sign and just realize how complex it is, how complicated, it would be very, very easy for that person to be tripped up, particularly when they're having to make a decision very, very quickly and potentially feeling quite stressed if there's a large queue of traffic behind them. So tools and technology can really be any piece of equipment that we interact with. And, good design can really help to reduce errors. It can help us to increase efficiency and essentially contribute to a better user experience. I often think about it in terms of an engineer will usually consider how something's going to work. So how to make something work and what that process is from a technical perspective. A designer will largely be focusing on the aesthetics of a piece of equipment or a tool and how it looks. And a human factors specialist will be thinking about the person who's going to be using and interacting with that piece of equipment, how they're going to use it, what they need that piece of equipment or that product to do, and what they need it to look like in order for the user to be successful. So a human factors person would look at these road signs and probably have quite a lot of areas in which they wanted to make improvements in order to help the user be able to be at that junction and make a decision correctly in a very short space of time. If you are designing something, it's very unlikely that you're going to hit upon that final design first time round. So design is very much an iterative process. So make designs intuitive, provide feedback to the user, think about how they're going to use a piece of equipment and think about the environments in which they're going to be placed. There's a whole other sort of hour plus that we could do on design alone, but I'm going to move on now to thinking about people to help give this snapshot of what human factors is all about. So people are really at the centre of what we're doing in terms of human factors. We're all different. We have different skill sets. We come from a range of backgrounds. We might have differing needs. We might have differing expectations. So think about any innovation that's been developed and think about who the people who are going to interact with it are. What are their important characteristics? What differences are there between different groups, different attitudes, different motivations or expectations? And what are their physical characteristics that might be important? So don't just design for yourself and don't just design for what you think is the average person, because really the average person doesn't exist. Making sure that we include all the potential users in any design of a piece of equipment, a task or a process can be a really challenging thing to do, and it can be very easy to just not really think too much about that because it feels too complex. But it's really important to understand who's going to be involved in the work that you're looking at and think about what will be important to them. So if you were designing a handheld device, you'd want to look at hand anthropometry, hand sizes. If you were designing an interface, you'd want to think about text size, the colours that you were using, the way that information was presented. If you're thinking about designing a new work process, you want to think about how much you're asking somebody to do at any one time. Is the workload too high, or actually is it too low? Think about contrasting situations in terms of air traffic controllers, the workload level there. But also think about situations where workload is potentially too low. So autonomous vehicles, for example, where people don't have enough to do to keep their attention. So what happens then in an emergency situation? Are they able to respond as quickly as they need to? Think about the physical environment that you're going to be either changing with an innovation or that will be used in combination with a piece of equipment or a new task that's being developed. Some environments are incredibly complex. So thinking about hospitals, think about sort of how pressurized they are, the complex areas where there's potentially lots and lots of people interacting with lots of different technologies. So if you're designing a device, you might wonder why an environment is important for you to consider. But don't just think about the design of a device, for example, in isolation. Think about the environment and the context in which it might be operated in. You know, think about the layout of that environment, the available space where a device might be used. How might the ambient lighting or the temperature, noise, etc., affect the user and their ability to operate a device? If it's a really loud environment and you've got a device that's heavily reliant on alarms, can people hear those alarms? Thinking about the temperature and whether a piece of equipment can work in that temperature. Is the lighting too bright or too low for a user to interact with a piece of equipment? Would a device need to be floor standing? Does it need to be mounted on the wall or fixed to another piece of equipment, such as a hospital bed or a trolley? So thinking about the way a physical environment is laid out is really important. Thinking about how somebody's going to work in that space. Is there going to be lots of toing and froing? Because the items that the user is required to use are located at opposite ends of the room, so people having to go backwards and forwards continuously. Is there enough space, light? What's the temperature like for individuals? I saw last year a pharmacy room that had been relatively recently refurbished without any consultation with the users who were going to be working in the space. And at first glance, the room looked really clean, it looked modern, lots of storage space. But when you actually watch the people working in the space, I saw staff moving around, accessing what were essentially kitchen cupboards, sort of quite high up. And there was one particular individual who needed a footstool to access all of the cupboards. So she was moving around this room constantly with this footstool, standing on the footstool, then reaching up, opening the cupboard door, reaching into the cupboard to get the item, close it, and then on to the next one. And she was getting thoroughly fed up at having to lug this footstool around and having to reach up into high cupboards numerous times in an hour even to access what she wanted. I've put a diagram on the screen of a clinic room that I was asked to go and look at some time ago, and staff highlighted two main problems with this clinic room. So firstly, it wasn't big enough, they felt, for the number of people who could be in the room. So that could be two clinical members of staff, a patient, and if the patient decided to bring somebody with them, that could be 4 people. And they also felt that the room completely lacked privacy because there was no curtain in the room to shield the door. So just looking at this very briefly and with that minimal amount of information, can anybody think about how they might improve this this room to make it better? Getting a sledgehammer to it and knocking some walls through. One of the things to do firstly is to question everything that's in there and don't assume that everything has to be there or it has to stay as it is. Any ideas? One thing I always start off doing is asking people how they use the room and observing how people use the room and using the room in real life scenarios rather than asking to simulate it. So actually, when you look at a space, you'll often see that there are areas of that space that they don't use at all. And while storage is, in some areas, absolutely crucial, in this area, they had a whole work surface with storage underneath that they didn't use and they didn't need. So actually, by shifting things around a little bit, we could make a lot more space. The clinical staff said that they could get away with a smaller couch, which meant that they could rotate it and push it to one end of the room. By getting rid of the work surface space, or to a minimum, so they just accommodated the sink, they could then relocate the computer and push all of the clinical stuff down to one end, and then put a curtain across, as you can see by the dotted line. You know, solutions like this aren't necessarily going to make a space any bigger or ideal, but sometimes just thinking objectively about a space and really understanding what's going on and how people are working can be really important. So you might not actually be designing any environments at all. You might be, you might not be. But even if you're not, just thinking about how a space is used and what impact that can have on people and how they work and how successfully they work can be really important. And sometimes just tweaking things, just changing things ever so slightly can make a real difference and can be really beneficial to staff. While staff often have the best ideas of what to change because they know what works and what doesn't work, sometimes they can be quite blinkered, and actually a fresh pair of eyes to just question what people do in a nice way very regularly can just help people to observe an environment in a slightly different way and come up with some fresh ideas. So moving on to think about tasks. We complete numerous tasks every day. Some of them may be really routine operational tasks, which we do very, very often. Some of them are tasks which we perhaps don't carry out very often, or tasks that are only carried out in exceptional or emergency situations. If you are designing any tasks, it's really important to consider, what exactly needs to be done by the user and who that user is. What do they need to do in terms of steps to carry out the task that you're looking at? What information is required to complete the task? Will people need to interact with others or with other pieces of equipment? Will they need to communicate with groups close by or far away? Will they need to carry out this task in conjunction with others? Work is very rarely linear, and no more so, I think, in a hospital setting. So you might be thinking about your particular task or your process. Do also think about what that individual may be doing in conjunction with that. If you're designing a task, make sure you understand what actually happens in the workspace and not what you think happens or what you experienced quite some time ago, because things change and things move on. Before moving into healthcare, I worked in the nuclear industry, and one of my areas of work there was to look at procedures, and particularly those used in the central control room. So although I was mainly looking at the layout of the procedures and the language used, one of the really important things that we looked at was understanding how long each of the steps in a procedure took. And the reason for that was because in an emergency situation, if there were, say, 20 minutes from the start of a procedure to a core meltdown, it's no good if actually working through all of the steps in the procedure takes you 30 to 35 minutes. So making sure there that all the steps that are required can actually be carried out in the time that's available is another important element of task design. So generally, if you're designing tasks, people like to have a variety of tasks within their day. They like to have autonomy and some control over what they're doing. And they like to generally have a little bit of challenge to be able to utilize the skills that they have. And the last, sorry, thinking about tasks again, what I want you to do now is just spend a couple of minutes and I want you to write down step by step how you would make a cup of tea. I'm going to give you no more instructions than that, but I just want you to write down into bullet point steps how you'd make a cup of tea. When you've done, if you're happy to take yourself off mute, it's probably easier to actually quickly run through those steps rather than spend the time typing them in the chat. We won't need to hear what everyone's steps are, but a couple will be really useful. So Chris, you're waving your hand there. Do you want to take us through?
Fill the kettle and
Yeah.
switch it on, obviously. And
Yeah.
while it's boiling, get the cup, put in tea, coffee, whatever.
Yeah.
Boiled, pour water, go to fridge, add milk, leave room.
Excellent. Thanks, Chris. Can anyone else give me their steps? I can't see all of you, but if there's anyone else that wants to take themselves off mute, then please do so.
So I've got fill the kettle,
Yeah.
boil the water, take your cup from the cupboard, add your tea bag, wait for the kettle to boil, pour over the hot water, stir, remove the tea bag, add the milk, stir again, and then it's done.
Great. Thanks. So yours and Chris's weren't identical. They were very similar, but they weren't identical. Was there anybody else who makes their tea in a wildly different way to Joe and Chris? Or does nobody want to admit that?
Sorry, I've got one. I'm having technical problems today, so I'm trying to use this device. So I've got a slightly different one because I haven't actually got a kettle. I've got one of those ones that you press and hot water comes out.
Okay, yeah.
And so I decided to get the equipment, so including the cup and the tea bag, sugar if required, pour in the water once it's at 80 degrees, leave standing for a minute and add milk to taste.
Okay, thanks, Carol. And it's really interesting that you have got a different way of making that tea because of the equipment that you've got available. So I think that really nicely illustrates how the equipment that you have can change the steps in the task that you're potentially designing. And even though Chris and Joe's steps were quite similar because they both had kettles, there are still differences in and amongst what they did. So if I got you all to read out your instructions, they would all differ somehow. And what I haven't given you any information about is what equipment is available to you. You know, what if I told you that you were camping and you didn't have a kettle? Your instructions would have to change again. So just by doing this really quick exercise, we can see just with 3 people how the steps can differ and how much information some people put in, whereas other people may put in very scant information. So think about if you were giving those instructions to people who were perhaps new to the environment, well, which cupboard did they get the tea bags out of? How much water do they put in the kettle? There are potentially lots of questions that somebody would ask and potentially fail at making a cup of tea or come up with some challenges because they didn't know all of the information that would help them to carry out that task successfully. I'm just going to briefly go through the next slide because I'm quite conscious of the time and I do want to leave a couple of minutes for questions if we can. So lastly, really just thinking about the organisation in which we're working in, and this can cover an awful lot of things. So I'll just briefly pick out a couple of things to think about. We could be thinking about how rotas are designed. We could be thinking about the skill mix within a team. Do we have the right skill mix for the jobs that we want people to undertake? Do you know everybody in the team? So there are some instances at work where teams work together very closely day in, day out. And in these situations, you very quickly get to know the personalities, what they like, what they dislike, and thinking about how they work. So a good scrub nurse will be somebody who knows exactly what a surgeon is going to ask for almost before they utter the words because they've worked with them, they know the procedure, they know how that individual works. But equally, though, there are teams of people that may very rarely work together, such as pilots and cabin crew, but they have to very, very quickly establish a relationship and work together. So thinking about those sort of non-technical elements, so teamwork, how we coordinate and collaborate with other people, our work culture, work schedules, relationships, management style, all sorts of things can affect the organisation, how it works, how we fit into that, and how the task that we're doing fits into it as well. The poster that I've got up on the screen, which I appreciate you probably can't read ever so clearly, is one that was developed, an adaptation of a set of principles called the Dirty Dozen, which was developed for the airline industry in America, of things not to do in terms of how not to communicate, how not to do teamwork. And at University Hospitals Birmingham, we flipped that around and we tried to create quite a positive poster, which was looking at what people should do in order to create a nice, safe and efficient environment. So I've very, very quickly gone through human factors. It's been a bit of a whistle-stop tour, but hopefully I've given you a bit of a taster to human factors principles, to people, to tools, technology, organisation, environments and tasks. So whilst it is a brief introduction, I hope that it does give you an overview of the science and really its importance to human work. And human factors is going to be relevant to all innovations in some way. And good application of human factors principles can really contribute to the success of an innovation. The reason why we're talking about human factors right at the beginning is because that's absolutely the best time to think about human factors. It's so much easier to change the steps in a task or change the location of buttons or size of screen, text color, for example, when you're right at the very beginning or even at the prototype stage, because once you've launched a product or launched a system or a process, it can be much harder, much more time consuming and costly to try and change some elements that aren't working particularly well. I've put up some areas where you can look for some more information. These are very general places to go and hunt out some information. Once you start off looking, you may find that there's a particular area, such as task design, tools and technology design, or organisation that is more relevant to you or interests you more. And then you can sort of delve off into other areas. But I've just tried to put on some very general sources of information for you to start off with. But also have a look on Twitter. There's a big human factors community on Twitter. So if you started off with the Chartered Institute of Ergonomics and Human Factors as a Twitter feed to follow and then see where it leads you. So hopefully you found that an interesting introduction to ergonomics and human factors. We've probably got about 1 minute for questions, Joe. Is that all right? So if anyone does have any questions, or if there are any more in-depth questions, then I'm happy to answer them later on or via email.
Yeah, we should have time for 1 or 2 questions.
Okay.
If there are any.
Just stop sharing so I can see you all.
Francis,
Yes.
I was just thinking earlier on, Carol asked about changing mindsets. Now, very often I find changing mindsets can be about understanding what their concerns are and perhaps removing those concerns. I mean, I have other design aspects around this, but I was just thinking, especially with the figure of 8 diagram that you were just showing from that could be, and human factors could be a very useful tool in trying to help people change their mindsets, from my point of view, to fully understand and comprehend where the objections may be coming. It's usually through a fear of their job changing or losing the job. And I wondered if you had examples or activities or whatever that Carol or anybody else on the call could possibly use as part of changing mindsets.
Yeah, I think that's a really good one to bring up, Chris. I think understanding the way that people work, why they work that way, is one of the really important things to do. because I think that when things are changed in a working environment, it's not always done by people who are actually in that environment and understand the work that is actually happening. So I think by really understanding how people work, why they work in that way is really important. People make shortcuts quite often in their work, and that's not usually done with the intention of making a mistake. It might be because that's the way that they were taught from somebody else. It might be because the procedure that they're required to follow just doesn't really show the true reality. That piece of equipment that they're supposed to use is never there. People sometimes get a little bit anxious though if their workarounds are scrutinized because they think they might be getting into trouble, for example. So they're very resistant to change because they want to be quite protective of the way they work because it works for them, but it might not be strictly what they're supposed to do. I think sometimes coming in with fresh eyes and with objective eyes as a human factors specialist can be really useful here because you're not management. So people can sometimes open up a little bit more to you because if they understand what you're doing and understand that you're there to help them work safer and more efficient, you're not there to, I suppose, hit them over the head with a big stick and tell them off for doing the wrong thing. That can sometimes be really useful. I think one of the biggest things is to talk to people and to really understand what people's views are. So focus groups, for example, with staff and actually involve them in any decision making can be really useful because then they will find some ownership. So just very briefly, I worked on a change in process within the emergency department at QE a while ago. And actually the change that we ended up implementing was a change that was decided upon through a couple of focus groups with all of the staff. And because we'd all agreed and talked about this particular change together, the team really felt a sense of ownership of this new process. And even before I left the department, they were dragging chairs around and they were putting up signs in the ED department. And I think the biggest test then was for me to go back a few weeks later and still see that process there and still being used, because if they didn't like it, they would have changed it. But I think really the reason why that process was successful was because nobody was imposing that change on them. The team collaboratively worked and came up with that together. So I think talking to people and getting people's views through a focus group can also be a really important tool.
Yeah. Thank you, Fran. I think it's a fascinating subject, and we could probably spend another few hours talking about it and going through it because it is so integral to the innovation process when we're working with people and considering all those factors, and to make sure, like you say, at the start of the process that we're working in the right way and considering the needs of the user. Really important. So thank you for that. I think that was really interesting.